Hello, ladies and gentlemen. Welcome to my presentation. This is going to be a quick one, a very short presentation. I'm just responding to a question that one of the students asked me. Okay, the question is that what are the roles of a nurse in the prevention of suicide? What are the roles of a nurse in the prevention of suicide? Okay, so to answer that question, I would like to take you back to fundamentals of nursing. In fundamentals of nursing, we learned about some of the roles of a nurse in some of the roles of a nurse. Okay, uh, those same roles of a nurse, we can use them, but in this case, we apply them in preventing suicide. So let's talk, for example, of a role of researcher. Okay, so nurse is a researcher. Um this role in this role by using this role, the nurse is going to gather information, so there will be data collection. Okay, so for you to be able to put in any form of interventions, you need to have information about something. You need to have full information. You need to know what are the causes, the predisposing factors. You need to know who is at high risk so that you can nicely intervene or prevent the condition from occurring. So in this case, we are preventing suicide. So you do data collection. When you collect this data, you are playing the role of the researcher as a nurse. Okay. So apart from that, you are going to carry out what we call you can discuss what we call another role we call as an educator. Educator, or let's say collaborator first of all. As a collaborator, you are collaborating, you're working hand in hand with other stakeholders in the community. You're working with the Ministry of Health, of course, you're working with the schools, the Ministry of Education, you're working with community leaders, you're working with community volunteers. Okay, so you collaborate with these stakeholders in order for you to put in um, preventive measures against suicide in the community where you are. Okay, so you work as a collaborator, you play the role of collaborator. Another role that you can play is the role of educator. Role of educator, you are educating now the community and the people at risk, of course, of committing suicide. So you play the role of educator where you disseminate information through media, through schools, and through churches, and through community leaders. You or by holding meetings with the community members, you educate them about the effects of alcohol abuse, the and how they can resolve their normal stresses of life. Okay, and the other role that you can talk about is the role of so sorry so I've talked about three. I've talked about three roles. I've talked about the role of researcher, the collaborator, educator. You can talk about the role of a resource mobilizer. As a resource mobilizer, you need resources when you want to carry out any form of intervention. For example, if you want to go and educate the community members and you have to move from your station, from your facility, you need fuel. Okay, so how would you mobilize these resources? The district can come in. So you just make arrangements. You plan for these things. Okay, you are mobilizing resources. Resources could be human resource as well. So you need human resource. Community volunteers can help you. They come through to organize the people and all that, and to help you disseminate the information. Okay, so you are playing the role of the source mobilizer by making sure that you have available resources for you to be able to carry out your interventions. If it's education, you also need to have what educative materials like flyers and everything that you need to just be able to educate the people in that community. Okay, so I've mentioned four so far. The other role you can play is the role of a counselor. You need to counsel some of the patients or potential suicidal clients, especially those who attempted suicide before and they survived. They will need counseling for them not to repeat uh, their act once more. So you play the role of a counselor by giving psychological care and counseling to victims of suicide, those especially those who attempted suicide and they survived. Okay, so those are some of the roles. There are many roles. Also, there are many other roles like the role, therapeutic role. There are other roles that you can talk about. So you can just think outside the box and find out more answers. But these are some of the few roles that you can talk about. I hope I have opened up your mind. I've opened up your mind, and you can now think about more roles that you can play in the prevention of suicide. Thank you so much for listening to my presentation, and please remember to subscribe and invite more people to this um, site, and come back next time. Okay,